Welcome to the Nonprofit Nexus, the podcast where we explore the intersection of cultural awareness and meaningful impact. In today's interconnected world, the nonprofit sector stands as a bridge across diverse communities, cultures, and causes. But what does it take to navigate this global landscape effectively? The answer lies in global competence. The ability to understand, communicate, and work with people across cultural boundaries, and its essential role in saving lives and driving positive change. I'm your host, Whitman Shiflett, and in this series, we'll dive into the real-world impact of multiculturalism in the nonprofit field, specifically the healthcare field. Together, we'll uncover how cultural flexibility doesn't just open doors, but builds sustainable, transformative solutions to global challenges. We will also dive into what these ideas look like practically and how in the field of nonprofit healthcare, just how crucial it is. So what is global competence? The Organization for Economic Cooperation and Development, or the OECD, defines it as the ability to understand and navigate global and intercultural issues, communicate effectively across cultures, and act with openness and shared responsibility. Similarly, Darla Deardoff's framework in the Sage Handbook of Intercultural Competence emphasizes attitudes of respect, curiosity, and empathy. In the nonprofit healthcare sector, this translates into understanding diverse health practices, overcoming language barriers, and addressing disparities with sensitivity and respect. So as a real-world example of this, we will use Georgia Highlands Medical Services. Georgia Highlands Medical is a nonprofit that provides accessible and affordable healthcare services to underserved populations in North Georgia. Their mission is rooted in compassion, equity, and community outreach. Let's take a closer look at how global competence plays out in this context. So let's start with cultural awareness in healthcare delivery. Georgia Highlands Medical Services serves patients from highly diverse backgrounds, including immigrant and refugee populations. Cultural competence is critical for understanding how different cultures perceive healthcare, which can influence everything from trust in providers to willingness to seek treatment. For instance, in my interview with the CEO of Georgia Highlands Medical, he discussed this concept of fatalism, which often gets ingrained in these communities. It's a belief or attitude that events are predetermined and inevitable, often implying that individual actions have little to no effect on the outcome. If a patient knows that her mother died of diabetes when she was 58, then that means she will die of diabetes at 58. Healthcare workers with a global competency mindset are better equipped to navigate these differences, build trust, and provide care that respects cultural preferences while also solving these issues and inspiring these communities that life can be different. There's also overcoming language barriers. So language can be a significant barrier to healthcare access. At Georgia Highlands Medical, interpreters and multilingual staff are essential for ensuring patients can communicate their needs and understand their treatment plans. This isn't just a matter of convenience, it's about patient safety and empowerment. Global competence means more than knowing a second language. It's about recognizing nuances, understanding nonverbal cues, and being patient and adaptable when communication isn't straightforward. And according to Georgia Highlands Medical Services, it also means working alongside the communities they serve, which means having people from those communities working within the organization as well. The nonprofit healthcare sector focuses on providing accessible and affordable medical services, often to underserved populations. This work isn't just about medical expertise. It requires a deep understanding of social determinants of health, community outreach, and the ability to navigate diverse cultural landscapes. For those interested in pursuing this path, graduate level preparation can make a significant difference. Programs such as a Master of Public Health or a Master's in Global Health focus on leadership in healthcare, policy, and community health. These programs often emphasize global health challenges, intercultural communication, and strategies for improving health equity. However, there are other ways to improve cultural competency as well. Study abroad programs, language immersion, or volunteering with diverse communities can deepen your understanding of cultural differences and improve your adaptability as well. Georgia Highlands Medical Services offers a clear example of global competence in action. Their work with the Hispanic and Latino communities in North Georgia shows the importance of building trust through cultural awareness and bilingual staff. Over the years, they've developed programs that respect cultural health practices while addressing challenges like fatalism. By inspiring hope and providing education, they've empowered these communities to take control of their health. In my interview with the CEO of Georgia Highlands Medical, he emphasized the critical role of building relationships in his work. A significant part of his responsibilities involves fostering partnerships with community organizations and collaborating with their leaders to address healthcare challenges effectively. He also highlighted the importance of engaging with connected leaders, individuals without formal titles, but who hold influence and respect within their communities. By cultivating trust and cooperation with both official and unofficial leaders, he ensures that the organization's initiatives are grounded in the needs and values of the communities they serve, creating a more inclusive and impactful approach to healthcare access and delivery.
Again, for example, at Georgia Highlands, we're now delivering babies of babies. So they understand us as somebody they can trust, somebody that cares, as opposed to other places who may be trying to exploit or at least adapt to that population when, again, I'm saying it again, the population that works for Georgia Highlands is also the same population that we're serving.
As we wrap up this episode, it's clear that global competence is not just a concept, but a vital skill set that drives meaningful change in the nonprofit healthcare sector. Georgia Highlands Medical Services exemplifies what it means to serve with compassion, equity, and respect for the diverse communities that rely on their care. By fostering trust, overcoming language barriers, and understanding cultural perspectives, they demonstrate the power of aligning an organization's mission with the principles of global competence. Global competence is essential for anyone pursuing a career in nonprofit healthcare. It's about more than understanding cultural differences. It's about building trust, fostering collaboration, and addressing health disparities with empathy and respect. As we've seen through Georgia Highlands, this approach creates lasting impact, stronger communities, and healthier outcomes. Thank you for tuning in to this exploration of healthcare and global competence. Until next time, take care and stay inspired.